Life is Precious is a big family where we all help each other through difficult moments.
LIP has helped me during the pandemic by being able to talk to someone when I need help.
Life Precious is an amazing program where you can learn so many new things that you never knew how to do, and you can meet new people and make new friends.
I'm Linda Hirsch, and this is EdCast, a program created and produced by educators for everyone interested in education. The suicide attempt rate among Latina teens is alarmingly high. Often residing in chronically underserved communities, they face several unique mental health challenges, which have been exacerbated by the COVID-19 pandemic. Life is Precious is a program which seeks to reduce the risk of suicide and improve the daily quality of life for these teens living in New York City. Today, EdCast speaks with its creator to learn more about the work of the successful initiative. Coming up now on EdCast. Joining me today is Dr. Rosa M. Gil, founder, president, and CEO of CommuniLife. Under her leadership, CommuniLife created Life is Precious, a nationally recognized program for Latina teens who have seriously considered or attempted suicide. In addition to creating numerous programs that address the many housing and health issues confronting minority communities, Dr. Gil serves on numerous federal, state, and city commissions, including Deputy Chair of the New York Federal Reserve Bank and the New York State Suicide Prevention Council. She has also recently been appointed to the New York State Vaccine Equity Task Force. Thank you so much for joining us today on EdCast.
I'm really delighted to be here, Linda. A pleasure.
We began by running some footage about Life is Precious, the organization, and I did want to ask you, what do we know about the suicide rate among Latina adolescents?
Suicide ideation and suicide attempts among Latina adolescents, believe it or not, has been a challenge since 1995. The Surgeon General report in the year 2000 showed that even way back, CDC was already tracking the high incidence of suicide ideation and attempt by Latina adolescents in comparison to other teens, African American, Asian, and white. So this is a long-standing challenge that we have seen in the Latino community. Of course, for us at CommuniLife, about 15 years ago, we saw the increase of adolescents being referred to an outpatient mental health clinic that we had in the Bronx, and they were referred because they had suicide ideation and suicide attempts. And quite frankly, that gave us, the board of directors at CommuniLife and myself, a challenge. How do we respond to this challenge? What do we need to do? Working with the community to understand it better. So, one of the first things that we went to the evidence-based practice by SANSA, which is the Substance Abuse and Mental Health Agency of the federal government. And they have this wonderful registry of all evidence practice in mental health. To my surprise, there were no evidence-based practice 15 years ago to address the issue of suicide ideation and suicide attempts by Latina adolescents. But it's even further surprising that in 2021, there's still no evidence-based practice for suicide ideation and suicide attempt among Latina adolescents.
Why do you think that young Latinas have the highest rate of suicide attempts in the United States?
It has multiple factors contributing to this phenomenon. One of them is the problem of acculturation stress. And we have seen in the research literature for many years, research findings that For example, after Latino immigrants get here to the United States, they, for example, the boys express their acculturation stress in different way than Latina adolescents, meaning they have more behavioral issues around participating in gangs or substance abuse, so forth and so on. For the girls, this issue of suicide attempts and ideation have to do a little bit with the acculturation stress of living in two cultures. The parents continue to think of the old culture while the girls are going to school and then want to be like the other teenagers. So they may want to go out with their boyfriend at regular time, 8 o'clock, and mother will get very upset because I said, well, when I was in Dominican Republic, I didn't go out to 7 o'clock without a chaperone and with my boyfriend. So the issue is around family too, is acculturation, is the issue of independence and autonomy in the Latino culture, which is a little bit different in terms of the American culture and American society. So you have acculturation stress, you have the cultural adaptation to a new country, and then you have the issue of poverty, which many of these Latino immigrant experiences. And of course, there is different challenges around mental health and that are exposed to these adolescents at home.
Now,
So
I'm sorry, go ahead.
Go ahead.
We know that COVID-19 has made so many things worse for so many people. What have you seen of the impact of COVID-19 on these suicide rates and on suicide prevention in this group that you've been working with?
Say that I have been in this field for about 40 to 45 years. And I really had never seen the impact of a phenomenon such as COVID to have such an impact on the mental health of the Latinx community. Let me start by saying that the New York State Office of Mental Health, which is the mental health authority in New York State, did a survey and found that 42% of Latinos experience high depression and suicide and anxiety due to COVID, the highest among any other group in New York State. So that's the family and that's everybody else. But what happened, Linda, is that the combination of close down, everybody was home. I have to say that sometimes this family, there are 7 or 10 people living in one bedroom apartment, so it's overcrowded. And you can imagine what it is to be in your home for 7 days, 24 hours. And on top of that, then the girl had to, quote, remotely go to school. And we have to say that I wish that the level of education would have been better remotely, but it didn't. Families were asked to help their daughters with the educational process, and they felt very inept because they were not even English speaking. So the isolation is a terrible or very challenging impact in the mental health issues of these adolescents that already came to us with suicide ideation and depression. But in addition to that, Linda, this community was really impacted because, for example, in our program, more than 80% of our families, they lost their job. They're undocumented, so they couldn't get unemployment help. 55% of the family experienced a member of the family who died because of COVID. So we had the element of grief on top of everything. Then the fear that they didn't have money and they were going to be put out on the street homeless because they couldn't pay the mortgage. So all of these compounded on the family not knowing whether they were going to be okay one day to the other, has really resulted in an unprecedented number of psychiatric admission for these adolescents.
Mm.
We have been running this program for 13 years. Prior to COVID, we perhaps have a couple of 1 or 2 psychiatric admissions. After COVID, as a matter of fact, as of last week, there are 26 psychiatric admissions by 17 girls in the program. This is unheard of. And actually, I have reached out to my colleagues who are doing research throughout the country just to try to find whether this is just a phenomenon in New York City or they are seeing this throughout the country. But the reality that Life is Precious is the only program in the country, in the state, and in the city. So we have the data and we are able to see what's happening, but I don't know whether other localities have the capabilities that we have in terms of data.
So what I'd like to do, you sent me some very interesting footage, and we're able to hear from 2 young women who really speak about some of the problems that they've been having, Alma and Emily. So let's listen to what they say about their lives right now.
I think in the Hispanic community, we have a lot of problems with mental illness or depression or things like that. And they're always like, they're not really open about this type of problems, because even though it affects them, there isn't like someone to support them. So they just keep like doing what they're doing, and we never get to work on these issues. But I guess our generation is in charge to change this type of mentality in the Hispanic community.
My father is an alcoholism, right? He's an alcoholic, and when I was 12 years old, he abandoned me, right? He decided to choose his alcohol over me, and so it was hard. And my mom and my therapist were there through everything until like one day he decided to show up out of nowhere, which caused me stress and depression and so many other things. Like until like the 3rd day that he didn't come and see me anymore, I ended up having epileptical seizures, which really affected me. And now I can tell like my therapist that I know so many like girls and boys go through that in their families, but something you should know is that if they fight hard and choose like happiness over depression, they could see the light at the end of the tunnel.
I don't really think it's easy to do that in a Hispanic community or in a Hispanic household, which is like kind of hard for us because we don't get to be listened to. So that make it worse for us.
They both tell very compelling stories. And I want to ask you, how typical are the issues described by Alma and Emily among other Latina girls?
It's very typical for them to experience the same problems that were described by these 2 girls. And not only we see the similarity of the challenges that they have with the other participants of Life is Precious, but in my work in mental health, this is a continuous issue that we have tremendous amount of challenge in accepting mental illness. Is always referred as a loco, the crazy one. So nobody wants to go to a mental health clinic. Nobody thinks that they want to get near a psychiatrist because they will be rejected in their community. So like Alma said, goes on, and people are depressed and they're anxious and they're suicidal and they're afraid of seeking help. It is true, Linda, though, that we also need to look at the mental health delivery system in New York City, who basically has not yet really developed mental health programs which are in a way addressing the needs of ethnic and racial minorities, and to understand these cultural issues about mental illness, and it's business as usual. And for this community, that's not what they need. And that's why we created this community-defined evidence-based practice, which is Life is Precious.
Well, let's talk about Life is Precious, because it is a very successful program. And if we're looking for other communities and agencies to do something to help these kids, then they have a model here. So tell us about, when did you start Life is Precious and what do you offer?
We got some money for our research efforts in the South Bronx, and we did a qualitative research that we involved the families and adolescents in a randomly sample to find out from the community, why is it that we saw so many adolescents with these challenges of suicide ideation and attempts. And quite frankly, it was very helpful for all of us to learn what the mothers and the fathers thought about it and what the girls thought about it. And we learned that they didn't believe that the mental health clinics were delivering these services. Actually, they told us, the researchers, that the only thing that the mental health clinics did was to push pills. And they were afraid of their daughters becoming addictive, right? So they told us about these schools. They didn't think that the school understood the challenges of immigrant mothers, undocumented here. So they themselves said that the stresses that I identified before, which is poverty, acculturation, the cultural domains of growing up as an adolescent in this country versus growing up in Colombia, in Bogota, as an adolescent, and making that transition. The parents were very eloquent about. And they told us, if you want to help out, create a program which is after school that they can trust, that they feel is safe, that they can drop in, that they can talk about their challenges, and please help them to get additional tutoring, because every time that one of them do not move to the next grade, then they get very depressed and upset that they're being left behind. So they told us to create tutoring. They told us to create a way, creative art therapy, to talk about their problems without, quoted labels of the mentally ill. And especially the teenagers that we interview as part of the focus groups told us, please work with the mothers, because the mothers do not understand what it is to grow up in an American society when you are a Latina adolescent. And those are the design that we use for Life is Precious. It's an after-school program between 4 and 7 o'clock. And we have a lot of activities for the girls. And we have continued to do so even remotely during COVID.
We have some footage of a mother speaking about some of the concerns that parents have. So let's listen to Luz.
Cuando nosotros tenemos estos problemas con nuestros hijos, es un shock, es bastante fuerte, porque yo también tuve y tengo problemas con mi hija. Recién comienzo en este programa. Estoy asombrada del gran apoyo que de verdad recibimos y de todos los problemas que tenemos mientras que se desarrolla esta enfermedad, porque es un comienzo, ¿no? Margarita, wow, nosotras no sabemos, necesitamos mucha dirección, necesitamos mucho apoyo. Yo, antes de estar en este programa, tenía tantas preguntas, no sabía qué hacer, yo no sabía cómo manejar esta situación, tras de que un problema mental, porque salud mental es muy, pero muy complejo.
She articulates very well the concerns that parents have and their feeling of really not knowing what to do. That mental health, as she says, is a complex issue. So going back to the services that you offer, you mentioned that this is after school and on Saturdays there's a program. You have wellness and creative arts. You have workshops. Do you also work with academics or do anything with counseling for college or for schoolwork?
Sure, we have had volunteers from Fordham University that have helped the girls with tutoring, and we always welcome the opportunity to, for example, we do have the schools of social work are having first or second year students to do their internship work, and Life is Precious, because we're very much interested in working with academia and how to help professionals to understand the challenges of the Latinx community regarding mental health, and suicide is just one of the issues that impact us.
How do people and families and girls find out about the program? How do they get into the program? Tell us a little bit about, if people are watching and they're thinking, I could use this, what do they need to know?
Well, it's easy if you think that that your daughter is having some of these issues of depression and suicide thinking, ideation. You can reach out to us. I'll give you a telephone number, 212-219-1618, and basically call us and talk to us, and we can discuss the particular situation of your family or your adolescent. And we have this program in 4 boroughs. So we get a lot of referrals from the schools. We get referrals from churches, from emergency rooms, and also from other nonprofit organizations. But if anybody is watching us as we talk, please don't hesitate to reach out to us, because I think that we are really committed to help families and Latina adolescents at risk of suicide.
And are these services free of charge?
Yes, they are. We don't charge any monies for these services.
I was just reading online this morning prior to our interview how difficult it is to get young people to show up for mental health services, to ask for help. I don't just think it's like, I think among young people in general, it's very hard. So are you concerned, or how can we address the issue of young people who may just not want to reach out? Are we reliant then on families and schools sending them, or is there any way do you address this in some way, or can you?
I think for us, when the girls are into the program, they see that there is flexibility, that they can choose to do tutoring. For example, we have music. They can play music. They can do creative art therapy. So it's an attractive way, because you and I both know that as adolescents, group, not individually, but group is an important medium for us to share with each other, to talk to our friends, so forth and so on, right? So that's the difference with outpatient mental health clinic, which primarily is on individual psychotherapy with a psychiatrist or a psychotherapist. And there's not enough group work in the outpatient mental health clinics to try to say to these adolescents, what do we need to do to make this more easy for you? What are the changes? And that's what we have tried to do, Linda. We offer, for example, the opportunity for them how to learn how to cook. I neglected to say that, we do cooking, and they learn how to eat healthy, and activities of what they like. And it's a way of reaching out to adolescents and asking them, which is the best way for us to reach out to them to receive mental health services.
Before we listen to Alma and Emily again talk about how much they've gained from this program, Are there any parallel programs like this from other organizations for boys?
Not that I know of, but I'm thinking that, for example, in several occasions, I have asked, boys have asked me, what do you have for us? And my board of directors, we have contemplated, but we don't have the funds because it will have to be different activities. It will create much of a sport activities of and so on. But who knows, Linda, I'm always interested in trying to help. And if we get the funding to do a program for boys, we will be delighted to do so.
If it can be done, you will do it. We have completely run out of time, but I would like to end by listening to Alma and Emily tell us again about what they have gained from participating in your program, Life is Precious. And I thank you so much for taking the time to joining us today.
Thank you for having us.
Sure.
LIP is a great group for girls because they are there, the staff members are there for every girl, and they always help each girl individually, and if they need help in some kind, they are always there to listen to them and try to find like good solutions for them. The minute I entered LIP, it was life-changing because the staff members in Queens, Lupe specific, she helped me with my mental health like nobody else could, and it was amazing. And I thank LIP every day for that.
And also, not just the staff, but also the girls there. We engage, and we also build a healthy community, which is awesome for girls that are starting to grow up, mentally. And yeah, that's how we help each other. For example, when we were in person, I would like make sure to ask everyone how they're doing, or we would just sit on the table and talk about our day. And Kimberly will come and she will ask everyone how's everything, or we would just eat in the kitchen while we were talking. And that was like when I was having a bad day, that was like the moment that I was like, maybe today is not really a bad day,
That's it for this edition of EdCast. We wish you all a very happy holiday and look forward to seeing you in 2022, which we hope will be a better year for us all.
We'd like to hear from you. Please send your thoughts and comments to cunyedcast@gmail.com.